if you have a Mirena IUD or other progestin-coated IUD going into perimenopause and menopause, it can be a little tricky to figure out where you are in this journey. It doesn't make it impossible, but it makes it a little bit difficult. If you started having this, if you had this placed and you never had cycles after that, then that's where it gets difficult. If you had it placed and you're having cycles and they start to become more regular, that could be an indication that you are in perimenopause, approaching menopause. If you never had cycles after it was placed and you were in your late 30s and, probably not in perimenopause and you didn't have those symptoms prior, then that means that progestin-coated IUD could be affecting your ovulation. Could be. It could just be enough to inhibit that endometrial lining from shedding. But that, if it gets more systemic and affects ovulation, it can influence your labs. So it can be tricky to see what is happening in your labs, unless you have labs from like before you started and after. The way I manage this, and the way you can ask your doctor or just ask yourself, is think about your symptoms, basically. So if you had this placed in your early 40s, you're feeling fine, and now you're reaching your mid 40s, and you're starting to having hot flashes or sleep disturbances or mood changes or brain fog, symptoms that could be signs of estrogen deficiency or libido changes, testosterone changes, then that would be the most important marker to say, okay, I should go, get this checked out or get treatment. If, you can get labs prior, I will get labs in some of these patients just to get a ballpark of where we are, and then treat accordingly, but, mostly based on symptoms. If, and as a trial sometimes, if we add an estrogen and you feel worse, then it's not that. But for some of my patients in this realm, they're having symptoms of low estrogen, they've had an IUD, maybe they're not having cycles, and we bring in estrogen and they feel better, then it's like, okay, and I check their levels and they're in physiologic ranges and the ranges that I like for estrogen, then we did it. Then we stay here or we go up or down depending on their symptoms. That same goes for testosterone. Progesterone, remember, with that IUD is plus or minus. You might need it, you might want it, or you don't have to. I like it for a lot of women, even with an IUD, but some people can't tolerate it. So there's, not a total way with labs that we have at this time to say like you are here in regards to menopause if you are not getting your cycles and you have the IUD, but it's not a reason to get it removed, if that makes sense.